tired of patients falling off your program or saying, I don't really feel any different. In this video, you'll learn how to set meaningful goals and track your patients' progress so they stay motivated, compliant, and fully engaged throughout your care plan. Stick around because I'll also share the exact symptom tracking tool we use to boost retention and validate our program results, without relying on expensive lab tests and retests every month. I'm Dr. Zac Watkins, and after years of running both an in-person and virtual practice, I've seen how proper progress tracking keeps patients committed and significantly improves outcomes.
You want to be able to track your patient's progress. And a lot of people do this differently. So I think the point of this, though, is in functional medicine and nutrition, it's very slow. Like responses we get in the body are slower versus like medicine is a lot quicker. It's anti-inflammatories, antihistamines, you're blocking biochemical pathways. So, but in nutrition, obviously it's slower. I like to have the example of, okay, medicines are there to kind of block pathways in the body, stop certain things from happening. Statins, prevent cholesterol from being produced in the liver, stuff like that. But, nutrition is almost like you're bathing the body with vitamins, minerals, nutrition to get the biochemistry pathway moving faster. You just speed it up. You're trying to get that chemistry to kick in gear. Those pKa markers, if you remember biochemistry, of a certain pH and when things start working, you got to push that stuff with some good nutrition. So the testing is good. That's why I always like the testing, the follow-up testing. I think doing in-between testing to know like other things, like you want to do hormones and gut. And, I don't think sometimes I think people go overboard, honestly, colleagues I've worked with. At the same time, though, I think it's okay and right to get the right test. One, you're going to validate the responses and why you're doing what you're doing. And two, honestly, it gives patients motivation. They see, this is my body. This is what's not right. I want to fix it. So that's why there's beauty in that, but there's also can be overkill if we don't touch it. So goal set. It's going to be important to do goal setting and tracking. Now, in my office, we always had a robust health coaching team, which, by the way, I highly suggest if you're a bigger clinic or even if you have the funds to get to your job as the owner, CEO, boss is to kind of work yourself out of a job is what they always say. Sticking in your wheelhouse, getting patients to your clinic, getting the client that you align with, that you're going to work with, that you can motivate to get well and onboard them into your programs where your team can now take care of them. They can do the follow-up. They can do the office management. They can do the tracking. Your job is just to steer the boat, if you will. But we had a robust health coaching team, and that was one thing that changed our practice a lot, was being able to bring on a team that could take care of a lot of the dietary stuff. I think we would all agree that dietary changes and lifestyle are one of the hardest things to change with our health. Supplementation stuff is helpful, but it's not going to be worth anything if you can't change your lifestyle and your diet. So it's great to kind of pass them off to my coaching team, and from them, they were able to track progress and all that kind of stuff. And the things that we tracked, and there may be ways you can do this, but think about it. It's like, tell me about your bowel movements today. How'd you sleep? What's your anxiety levels? Any kind of pain, swelling in your hands that might go down with inflammation being dropped. Weight is an okay thing to track. I never really did that much because we had a lot of people with eating disorders and just kind of issues with food and tracking their weight. And by the way, I'm not really a big fan of weight anyway. You could lose a bunch of fat and gain a bunch of muscle and you look ripped and in weight shape, but you weigh more. So it may not be the best tracker, but measurements around the waist, things like that. Now, I put in here a mention about the symptom survey. If you haven't seen that video yet, I recommend to go see it. And there's nothing magical about that, honestly. I'm not like sharing all this brand new crazy information that you've never seen before. But I'm just telling you what worked. Symptom survey is just a way to get data from your patients without having to do a lot of tests and expensive things. The things that you can get are great. Honestly, we did urinalysis, we did weight, blood pressure, body fat, muscle analysis, all that kind of stuff. But if you're virtual, what do you do, right? What are you going to do? So this is where I would really encourage, if you are more virtual, to talk about, ways that you can have your patients track things. Everybody's got a wearable device now, Apple Watch, a Whoop, and a big one. Side note, if you are a big enough business, you can reach out to Aura and you can cut a deal with them and be like a corporate sponsor, and they will let you buy Aura rings at a very discounted price for you and your team, but also to kind of resell back to patients. We, for a while, explored, we didn't get fully, but we explored about pre-purchasing Aura rings and bundling them into our care plans. So that way, patients got a cool little device, but it gave us a way to track the way they're sleeping and stress and all that kind of stuff. So there's lots of ways to do that. So whatever I think you like to track or things that are simple, really implement that and find a way, a system that's going to allow your patient to dialogue with you or your team to give you real-time feedback. So back to the symptom survey, there's lots of them out there. I put a copy of the one I used in that little module if you haven't seen it yet. But it's that simple. It's just asking symptoms from all these areas of the body, and it's asking how they're feeling, rate themselves and score them. And they need to complete it. The bad thing is you get men that would not complete it. I don't know what's with men, and they just don't follow directions very well. But it's a good way to track no offense to men, by the way. I am one, so sometimes I'm not as complete on my instructions either. But getting that information back was just helpful to kind of say, okay, Mrs. Jones, let's talk again about your symptoms and how you're progressing, and let's look at your overall score. Okay, we did this pre-detox and post-detox, and the reason I knew this worked is because when we do detox programs, or let's say after a month of working with us, if you ask them, how do you feel? How are things going? Things are fine, I guess. I'm following the diet. I'm getting bored. I don't know. I may have lost a little bit of weight. That's a good thing. But overall, I think, things are just kind of ho-hum, whatever. But when they filled this out, you'd have people that would drop their score 30 points, which is significant. And you could dive in and say which category lost the most, and maybe his gut health got better. And then they start thinking like, oh yeah, you know what? That's right. I can't believe I had those symptoms before. Now they just kind of went away. So it's a good way to validate, again, your programs and get real-time feedback without having to do testing like every month or something like that. Because again, another benefit of tracking is keep your patients engaged.
Hey, real quick, if you're listening to this and thinking, I need some help building out something like this in my own practice, well, just scroll down and click the first link in the description. You can book a free strategy call with myself or my team, and we're going to take a look at what you're doing now, where you're stuck, and show you exactly how to build a customized care plan that works for both your patients and your business. All right, back to the video.
If they're not engaged, they get bored, they fall off the track, they see something else on Instagram, they go to a different clinic, they do different injections. So as long as you're keeping them engaged, whether it's you, maybe as a provider, if you're starting out, you just get some homework. Say, here's a food journal. I want you to track your food for, let's say, 3 days this week. Doesn't have to be in a row, but just give me 3 days. And then send me maybe your blood pressure and your weight. Even if it's stuff I think it's not like earth shattering or, weight, whatever. But you're getting your patient involved, and they're going to be sending that material to you. They like to know that they're being cared for. And you're going to look at it, of course, but the main reason is to get them involved. So the symptom survey worked really well for us. We are in-office practice, so of course we did a lot of in-office measurements and testing. If I saw people virtually, of course I had my health coaching team that was talking more about tracking their bowel habits, stress levels, stuff like that. Again, if you know where your patients are trying to get from a goal perspective, try to align the tracking around that. Obviously, if it's weight, maybe track more measurements and stuff around weight. If it's gut health, maybe align some of your stuff that you're going to track around that. The symptom survey was just an easy thing to do. If you do have a robust team or team members or like staff, I guess, or employees, you don't need to be a full-fledged nutritionist or health coach, because you as the provider can teach them the questions to ask. Maybe it's a script, but make sure they fill it out. They check. Do you have these symptoms, 1 through 4? Start tracking these things and keeping some involvement. Again, patients like it, and it's a good way to make sure your plans are going as planned, basically. So think about that. Think of ways you can track. The wearables are going to be a really good option if you can. There are some companies out there that are learning to tie all of these wearables together into one platform. It's on the newer edge of things, and they're also using some AI to kind of work with that too. I remember seeing the beta testing for a couple companies that are pretty fascinating. So it's not pushed through yet. Like they're not out there, but they're coming. AI and some of the tracking and is going to be on the forefront. So don't give up on the wearables yet, because they're going to be just blowing up in the way that they're being used in practices. So I hope this is helpful, but always just remember that tracking something for your patients in your care plans keeps them engaged, keeps them involved, allows you to have conversation. If they start falling off track, that's where patients quit or they want money back and stuff like that. No, you got to keep them engaged and keep them excited. Show the good, see where we can keep making changing some directions and making some progress.
Hey, before you go, make sure to hit that subscribe button so you never miss a video. If you like this one, you're definitely going to like the next video. So click here on the screen, keep going, and I'll see you over there.